This presentation covers the anatomy and physiology of the female reproductive system. Take a look at this side view of the female reproductive system. We'll be covering these parts in this lecture, and you'll be looking at models and the cadaver in lab. This is a front view of the female reproductive system. You'll be viewing models of this in the laboratory. Be sure you know these parts. Here is an unlabeled diagram of the female reproductive system on which you can practice. The answers are on the following slide. Starting on the left and going counterclockwise, the answers are the fimbria, the ovary, the cervix, the vagina, the uterus, and the fallopian tube. This slide shows you a superior laparoscopic view of the female reproductive system. The large organ toward the center is the uterus. You can see the labeled fallopian tube on the left and the labeled ovary on the left. And there is a fallopian tube and an ovary on the right side as well, also evident in this picture. This unlabeled slide shows you the gross anatomy of the female reproductive system. See if you can identify the parts. The answers are on the following slide. Beginning in the upper left and going counterclockwise, the parts were the fallopian tube, the ovary, the cervix, the fimbria, and the uterus. We'll be talking about each of these parts. This slide shows you an inferior view of the cervix. The cervix of the uterus is the tapered inferior region. Its name cervix comes from the Latin word meaning neck because of its role as the narrow connection between the larger body of the uterus, which is above, and the vagina, which is below. The cervix plays a very important role in the control of movement into and out of the uterus, in the protection of the fetus during pregnancy, and in the delivery of the fetus during childbirth. The ovaries are a pair of small glands in the female reproductive cavity, and they're probably the most important organs of the reproductive system. The reason they're so important is because they play a role in the production of both female sex hormones that control reproduction and the female gametes or eggs that are fertilized to form embryos. An ovary is an almond-shaped organ, and at birth these ovaries contain all the eggs a woman will ever have. The hormones that they produce are primarily estrogen and progesterone. This is a microscopic slide of the ovary. The ovary is composed of a cortex, which is the outer portion, and a medulla, which is the inner portion. As cells mature, they move from the outside of the cortex down through the cortex and into the medulla. The most immature cell is a primordial follicle. From there it forms a secondary follicle and then moves on through the medulla, eventually forming a mature Graafian follicle, which contains the egg. This slide shows you primordial follicles and secondary follicles, but most of the picture is taken up with the mature Graafian follicle, which is indicated by the arrows. You need to be able to identify the four parts of the mature Graafian follicle indicated on this slide. The answers will follow. Those parts are number 1, zona pellucida, number 2, the antrum, number 3, the corona radiata, and number 4, the egg or oocyte. The uterine tube will carry an egg from the ovary to the uterus. Unless there's a biological abnormality or surgery or an ectopic pregnancy has caused the loss of a tube, women should have 2 uterine tubes in their body. A section of the fallopian tubes called the ampulla is where the egg cell is fertilized by a sperm cell. This fertilized egg cell then moves on into the uterus where implantation occurs. Some women can suffer from a tubal or ectopic pregnancy that puts their fallopian tube as well as their lives in jeopardy. Ectopic pregnancies result from a fertilized egg staying in the tube rather than traveling on into the uterus. The treatment for this is surgery, which terminates the pregnancy. Women who have had multiple sexual partners or a history of sexually transmitted diseases are more likely to suffer from ectopic pregnancies. Infections can also harm the fallopian tubes. If a woman no longer wants to have children, they can have their tubes tied, and this will prevent the movement of eggs from the fallopian tubes into the uterus. Because there's no direct contact between the fallopian tubes and the ovary, this puts a woman at risk for ectopic pregnancies and for PID. This animation shows you the process of fertilization. You can also click on this link and observe fertilization as well. I mentioned the term ectopic pregnancy. This is when implantation of the zygote occurs someplace besides the uterus. It can occur in the fallopian tubes, and you can see this in the diagram on the right, or it can occur in the peritoneal cavity. In most cases, ectopic pregnancies will spontaneously abort. The diagram on the left and the picture on the right show you an ectopic tubal pregnancy. The blue arrows on the right point to the uterus, and the red arrows point to the actual ectopic pregnancy in the fallopian tube. Here's another example of an ectopic tubal pregnancy. The tubal pregnancy is the dark round mass. On either side of that mass, you can see the pink fallopian tube. The following 3 slides are graphic. Please view them with caution. On the right side of the slide, you can see an ectopic pregnancy of about 5 weeks gestation. You can see where hemorrhaging has occurred. This is a ruptured tubal pregnancy, and on the left you can see the fetus. If it is ruptured, it usually means the destruction of the fallopian tube. In addition, it could be life-threatening for the mother. Treatment needs to occur immediately. This slide shows you another tubal pregnancy in which the fallopian tube ruptured. You can see the fetus on the left. Early on, an ectopic pregnancy often feels like a normal pregnancy, and the woman with an ectopic pregnancy probably will experience some of the common signs of early pregnancy. Those include a missed period, tender breasts, fatigue, nausea, and an increase in urination. As an ectopic pregnancy progresses, other symptoms may develop, including belly pain or pelvic pain that gets worse with movement or with straining, and it may occur sharply on one side first and then spread throughout the whole pelvic region. Heavy or severe vaginal bleeding, pain with intercourse or during a pelvic exam, dizziness, lightheadedness, fainting, also known as syncope, caused by internal bleeding. She may show signs of shock, and shoulder pain caused by bleeding into the abdomen under the diaphragm. This bleeding will irritate the diaphragm and is experienced as shoulder pain. Pelvic inflammatory disease is also known as PID, and it occurs when microorganisms escape from the reproductive tract and enter the peritoneal cavity or the lower abdominal cavity. The problem is it can lead to scarring and closure of the fallopian tubes, and this can be problematic. How do you get PID? Well, you're more likely to get it if you've had an STD and do not get treated, if you have more than one sex partner, if you have a sex partner who has sex partners other than you, if you've had PID before, if you're sexually active and 25 years old or younger, or if you have an intrauterine device. Complications of PID include scarring that can lead to closure of the tubes, and it's the major cause of female infertility. You can see in the diagram on the right that the uterus is a hollow and thick-walled organ. It's the location that receives the fertilized egg, and it's where implantation occurs. The narrow part of the uterus is known as the cervix. Cancer of the cervix is common among women ages 30 to 50. There are risk factors for developing cervical cancer. They include STDs, frequent cervical inflammations, and multiple pregnancies. Here again is the slide that you saw earlier showing an inferior view of the cervix. Following is a slide of cervical cancer, and it is graphic, so please view this with caution. Both of these pictures are examples of cervical cancer. There's a simple test for cervical cancer known as the Pap smear or the Pap test. It is a simple scraping of the cervical cells, which are then put under a microscope and viewed for precancerous and cancerous changes. This test is relatively painless, but there may be a slight bit of bleeding. In the past, it's been recommended a woman have a Pap smear every year beginning at age 18. Currently, the recommendation is a Pap smear every 3 years for women from ages 21 to 65. This slide shows you how the cells of a normal Pap smear should appear. This is a slide of an abnormal Pap smear. Compare it to the previous slide, and I think you can easily see the differences. The ovarian cycle is that series of monthly events that's associated with the maturation of the egg. Normal human females have 2 ovaries, and the ovaries alternate releasing an egg. The ovarian cycle is tied very closely to the uterine cycle, and we'll talk about that in just a minute. The average ovarian cycle is about 28 days, but this is just an average. Some cycles can be longer, some cycles can be shorter. The range of cycles is usually between 21 and 40 days. To determine the day that a woman ovulates, you would subtract 14 from the length of the cycle. So if her cycle was 40 days, 40 minus 14 means day 26 is the day of ovulation. The first part of the ovarian cycle can vary, the last part does not. This slide shows you an egg being released from an ovary. I mentioned that the ovarian cycle has two parts or two phases, and those phases are the follicular phase, which is days 1 to 13. Day 14 is the day of ovulation, and then the second phase is the luteal phase, which is days 15 to 28. The length of the follicular phase changes, but the luteal phase is always 14 days long. In this table, you can see the events of the ovarian cycle. Be sure you know what occurs during the follicular phase, the day of ovulation, and the luteal phase. There are three phases in the uterine cycle, also known as the menstrual cycle. They are the menstrual phase, which is days 1 to 5, and this is the time when the uterus sheds the endometrium, or the inner lining. This time is known as having your period. During this time, the ovarian hormones are at their lowest levels. The second phase is the proliferative phase, and this is days 6 to 13. It's a time when the endometrium begins to rebuild. It's just been shed, and it needs to rebuild to prepare for the next implantation should it occur. This is a time also when blood levels of estrogen begin to rise. During this time, ovulation will occur at the very end on day 14. Days 15 to 28 are known as the secretory phase, and during this time the endometrium prepares for implantation of an embryo. It's also a time when the progesterone levels are increasing. The menstrual cycle usually begins about the age of 12, although that continues to get younger, and lasts until about age 55. Things like strenuous exercise and dieting can delay the onset of the menstrual cycle. The term amenorrhea means the cessation of menses. Women who have missed at least 3 menstrual cycles in a row have amenorrhea. The most common cause of amenorrhea is pregnancy. The term menopause means the final cessation of menses. It's after 1 year without a menstrual cycle.